Good morning, everyone. Today, we're going to discuss disaster response organizations and how they operate at the local, national, and international levels. The topic is especially important for nurses because healthcare does not function independently during disasters. Instead, hospitals, clinic, and public health systems are integrated into larger emergency response networks. Understanding how that network functions helps nurses communicate effectively during emergencies, understand command structures, and participate safely and effectively in disaster response activities. Throughout this lecture, we'll examine the major organizations involved in disaster response, how they coordinate their work, and where nurses fit into these systems. Let me begin by reviewing our learning objectives. By the end of this lecture, you should be able to identify the major disaster response organizations that operate locally, nationally, and internationally. You should understand the roles of federal agencies, state agencies, and nonprofit organizations that function during disasters. You should also be able to explain how organizations coordinate their activities through structured emergency management systems. And finally, you should recognize opportunities for nurses to participate in disaster response, both clinically and in leadership roles. These objectives align with disaster nursing competencies that emphasize coordination, communication, and system awareness. The first concept to understand is why organizational structures matter in disasters. Disasters are chaotic events. There may be hundreds or thousands of injured people, damaged infrastructure, and communication disruptions. And there is almost always significant uncertainty. Without clear organizational structures, response efforts can quickly become disorganized. Multiple agencies may duplicate efforts while others' needs are ignored. Clear structures help establish leadership, communication pathways, and defined responsibilities. In disaster response, structure is what allows large groups of responders from different organizations to work together effectively. Disaster response occurs across several levels. The first level is the local level. One of the sayings is all disasters are local. This includes local fire departments, police, emergency medical services, hospitals, and local health departments. Most disasters are actually managed at this level. When local resources become overwhelmed, state resources may be requested. The state may provide additional personnel, specialized equipment, and National Guard assistance. If the disaster exceeds the capacity of the state, federal resources may be activated. In extremely large disasters, international assistance may also become involved. Understanding this layered system helps nurses understand where decisions are made and how resources move during disaster. So remember, you have the local response systems because all disasters are first and foremost local. Then you have the state and national support. Then you have international humanitarian response. And finally, you have collaboration across all sectors. So, let's start with local disasters. Local disaster response is the foundation of emergency management. Local agencies are the first responders because they are physically closer to the incident. Fire departments, EMS teams, police officers, and hospitals are the first organizations to respond. These organizations have pre-existing relationships and training exercises that prepare them to coordinate the response. Local governments also maintain emergency management offices that develop disaster preparedness plans, conduct training exercises, and coordinate across activities when disasters occur. So remember, you have your first responders that operate locally, uh, communities that manage most of their own disaster. But in extreme cases, there is support that can help you increase your capacity. Fire departments play a central role in disaster response. They're responsible for search and rescue operations, hazardous material response, and often incident command leadership. In many communities, the fire department also provides hazard materials response, technical rescue operations, and sometimes emergency medical services. Fire departments frequently assume the role of incident command at disaster scenes. This means the fire department officer on scene may initially serve as the incident commander, responsible for coordinating response activities. We discussed this last week. Police departments coordinate the disaster response by maintaining public safety and security. Their responsibilities may include evacuation, enforcement, traffic control, protecting damaged property from looting, and assisting with search and rescue operations. Police agencies also coordinate with emergency management agencies to support public warning systems and evacuation planning. And as almost everyone knows, they manage the traffic and the crowd control in most disasters. Emergency medical services, or EMS, provide pre hospital medical care during disasters. EMS personnel perform triage, which means sorting patients based on their severity of injuries. They provide stabilization and transport patients to hospitals. In large disasters, EMS teams may establish field triage areas and coordinate patient distribution among hospitals to prevent any single hospital from becoming overwhelmed. Hospitals and healthcare systems must rapidly adapt during disasters. Hospitals may experience sudden increases in patient volume, known as surge capacity. They must activate emergency operations plans, expand treatment areas, mobilize additional staff, and coordinate with EMS and public health agencies. Hospitals also use a structured command system called Hospital Incident Command System to manage internal operations during the disaster. Public health departments focus on the population level impacts of disasters. Their responsibilities may include monitoring disease outbreaks, organizing vaccination campaigns, ensuring safe water and food supplies, and communicating public risks to the public. Public health officials also collect and analyze data that helps to guide response decisions. To coordinate all these organizations, emergency management uses a standardized system known as the Incident Command System, or ICS. We discussed this in detail last week. ICS was originally developed to manage wildfires, but it now is used across all types of disasters in the United States. The common purpose of ICS is to provide a common organizational structure so that responders from different agencies can work together effectively. And as a review, the Incident Command System includes several key sections. At the top is the incident commander, who is responsible for overall leadership. The operations section manages tactical activities such as rescue and medical response. The planning section gathers information and develops action plans. The logistics section provides resources, equipment, and supplies. And finally, the finance and administration section tracks cost and documentation. When a disaster exceeds local capacity, state resources may be activated. Each state has an emergency management agency that coordinates statewide disaster response. Governors may activate the National Guard to assist with rescue operations, logistics, and infrastructure support. If a disaster continues to escalate, the state may request federal assistance. Federal disaster assistance usually begins when the president issues a formal disaster declaration. This declaration allows federal agencies to deploy personnel, equipment, and financial assistance to the affected area. If a disaster continues to escalate, the state may request federal assistance. Federal disaster assistance usually begins when the president issues a formal disaster declaration. This declaration allows federal agencies to deploy personnel, equipment, and financial assistance to the affected area. The Federal Emergency Management Agency is the primary federal agency responsible for disaster coordination in the United States. FEMA manages disaster relief funding, coordinates federal agencies, and supports recovery efforts following a disaster. Federal disaster response is organized through the National Response Framework. The framework describes how federal agencies coordinate with state and local governments during disasters. It defines responsibilities, coordination mechanisms, and operational structures. Within the National Response Framework, responsibilities are organized into emergency support functions, often called ESFs. For example, ESF 8 focuses on the public health and medical service. These functions coordinate hospitals, medical teams, and public health agencies and federal medical resources. Other emergency support functions are ESF 6, which is mass care. This is the shelters. ESF 8, public health and medical services. ESF 10, hazardous materials. And ESF 13, public safety. These are the ones you'll most commonly encounter in public health and medical. The Department of Health and Human Services plays a central role in coordinating federal medical response. HHS supports healthcare systems during disasters and oversees several specialized disaster response programs. It coordinates national health response and it manages the National Disaster Medical System. One of these programs is the National Disaster Medical System. This system includes deployable medical teams that can provide emergency care when local healthcare systems are overwhelmed. The Centers for Disease Control and Prevention also plays a key role during a disaster. The CDC monitors disease outbreaks, provides scientific guidance, and supports public health interventions. Nonprofit organizations play critical support roles during disasters. They often supply services that government agencies cannot provide as quickly, such as shelter management, food distribution, and volunteer coordination. These organizations support the affected communities and they work alongside government agencies. The American Red Cross is one of the most well-known disaster response organizations in the United States. It operates emergency shelters, provides food and supplies, and offers disaster health services staffed by volunteers and health professionals. I highly recommend that you search online for the American Red Cross and learn in detail about what they do. Another important coordinating organization is the National Volunteer Organizations Active in Disaster, often called VOAD. VOAD helps coordinate dozens of nonprofit organizations involved in disaster response and recovery. And and there are many organizations that are part of NVOAD. You can also look them up online. But it's organizations like the Southern Baptist Association, their food services that they provide, Lutheran Social Services, Lutheran Disaster Response, United Methodist Committee on Relief, and the list goes on and on and on. In very large disasters, international disaster assistance may be required. International humanitarian organizations provide emergency medical care, shelter and food assistance, and recovery support. The World Health Organization coordinates global health responses to disasters and disease outbreaks. It provides technical guidance, deploys medical teams, and supports damaged health systems. The International Federation of the Red Cross, or the Red Crescent Society, operates in nearly every country in the world. It provides humanitarian relief during disasters and supports community recovery programs. They are the largest humanitarian network providing disaster relief services. Nurses may have opportunities to participate in disaster response. Nurses may serve in disaster response teams, volunteer with the Medical Reserve Corps, work in emergency shelters, and participate in public health response. I would highly recommend that you check out the American Red Cross and the Medical Reserve Corps at a minimum. So let's talk about some key takeaways. Disaster response begins locally. Coordination systems guide response. Multiple organizations collaborate, and nurses play an essential role in disaster response. Nurses may have opportunities to participate in disaster response. They may serve on disaster response teams, volunteer with the Medical Reserve Corps, work in emergency shelters, or participate in public health response activities. Now, let's do a little case study because, well, we should. So let's look at a real disaster example that demonstrated how disaster response systems can succeed in some areas and struggle in others. Hurricane Katrina struck the Gulf Coast in August of 2005. Although it made landfall as a Category 3 hurricane, the catastrophic damage in New Orleans was largely due to the failure of the levees that were designed to protect the city from flooding. When those levees failed, large portions of the city rapidly filled with water. More than 1,800 people died, and hundreds of thousands were displaced. Local emergency services, including police, fire departments, and hospitals, were quickly overwhelmed. One of the major problems was coordination between different levels of government. Local officials, state agencies, and federal agencies were not always communicating effectively. Resource requests were delayed, and rescue operations were not coordinated as efficiently as they could have been. Hospitals faced extremely difficult conditions. Some facilities lost electricity, air conditioning, and water. Staff and patients were stranded for days without evacuation resources. Katrina became a defining moment in U.S. disaster policy because it exposed weaknesses in emergency coordination and hospital preparedness. The experience of Hurricane Katrina led to many important reforms in disaster response. One major lesson was the importance of strong local response capacity. Local responders are always the first to arrive, so communities must have well trained emergency services and clear disaster plans. Another lesson involved communication. Katrina showed that agencies must have interoperable communication systems so that police, fire, EMS, hospitals, and government agencies can share information in real time. Hospitals also learned that evacuation planning is critical. Facilities must plan for the worst case scenarios, such as loss of power, water, transportation, and communication. At the federal level, Katrina prompted revisions in the National Response Framework and improvements in FEMA coordination. Many of the emergency preparedness requirements that hospitals follow today included disaster drills and emergency operations plans, and these were strengthened after Katrina. So now let's look at a very different scenario. Let's consider the very different type of disaster, the COVID-19 pandemic. Unlike hurricanes or earthquakes, which occur suddenly, the pandemic was a prolonged global crisis that placed sustained pressure on healthcare systems for years. At the local level, hospitals and clinics were responsible for treating large number of patients, particularly those requiring intensive care and ventilator support. Local public health departments coordinated testing, contact tracing, and community education. Some governments coordinated emergency policies, expanded hospital capacity, and sometimes activated the National Guard to assist with logistics and vaccination programs. At the federal level, several agencies played key roles. The Centers for Disease Control and Prevention provided epidemiologic guidance. FEMA helped coordinate emergency resources and support vaccination sites. The Department of Health and Human Services managed the distribution of medical supplies and vaccines. And internationally, the World Health Organization coordinated the global disease surveillance response. For nurses, the pandemic highlighted the critical role of healthcare professionals in disaster response. Nurses worked in intensive care units, vaccination clinics, community health programs, and public health education. All right, let's do one more. The Maui wildfires. The Maui wildfires provide an example of how disaster response unfolds rapidly and can escalate without warning. In August 2023, fast-moving wildfires destroyed large areas of Lahaina in Hawaii. High winds and dry vegetation allowed the fires to spread quickly, overwhelming local firefighting capacity. Local fire departments and emergency medical services initiated the response. Police departments assisted with evacuations and public safety. As the disaster escalated, the Hawaii Emergency Management Agency coordinated the state-level response. State resources, including additional personnel and equipment, were mobilized. Federal support soon followed. FEMA deployed disaster assistance teams and coordinated federal resources to support recovery efforts. Nonprofit organizations such as the American Red Cross opened emergency shelters and provided food, supplies, and emotional support for displaced residents. The Maui fires demonstrate how disaster response expands from local responders to state, federal, and nonprofit organizations as the scale of the event increases. At this point, I'd like to pause and ask you to think about the systems we've discussed. So, the first question: why is a strong local response capacity essential during disasters? Remember that local responders are the first to arrive. Firefighters, EMS teams, and the hospitals must act immediately, often before outside assistance is in the area. Second question: what coordination challenges might occur between local, state, and federal agencies? Think about communication systems, leadership authority, and resource request. These issues were clearly visible during Hurricane Katrina. Third question: how did the COVID-19 pandemic differ from disasters such as hurricanes and earthquakes? Well, consider the duration of the crisis, the strain on healthcare workers, and the global scale of coordination required. Finally, where do nurses fit into the disaster response system? Think back beyond hospitals. Nurses may work in emergency shelters, vaccination programs, disaster medical teams, and public health response. So, I'd like to end with a short scenario exercise that helps connect what we've learned to real decision making. So, imagine that a large wildfire is approaching a rural New Mexico area. Hundreds of residents are evacuated, and the nearest hospital is receiving injured patients. So, your first question: which organizations respond first? The second question: when would state resources likely become involved? The third question: what federal agencies might eventually assist? And finally, what roles might nurses play during the event? This scenario illustrates how disaster response evolves from local action to coordinated agencies. If you've listened to the lecture, you should know the answer to all those questions. But if not, go back and listen one more time. And if you have questions, come to office hours or send me an email. So, with that, do you have any questions? And if you do, you know how to reach out to me. Please take the time. I will always be available in office hours, and I'm always around to answer your emails and your other questions. Thank you.